So, what if you could treat severe depression, not with a pill, but with, well, with physics? For millions of people who don't respond to traditional medication, this really isn't science fiction anymore. It's a real technology that's basically hacking the brain's own electrical circuits to bring new hope. Let's dive in and see how it works.
Okay, so first, we really need to understand the problem we're trying to solve here. For so many people, antidepressants are absolutely life-changing. But there's a pretty significant number of people who find themselves in this tough spot where the standard treatments, they just don't work. This is what's known as treatment-resistant depression.
And this chart, it tells a really powerful story about diminishing returns. You see, with a first-line medication, the chance of full remission is around 27.5%. Not bad. But after one medication fails, that number drops to just over 21%. And after two failures, it's all the way down to about 16%. The takeaway here is pretty stark. The more treatments that fail, the less likely the next pill is to work. It shows you that we clearly need a different approach.
And it's not just about whether the pills work. Traditional antidepressants are what we call systemic. They affect your entire body, and that can lead to this whole host of side effects. We're talking fatigue, weight gain, insomnia, you name it. But a more targeted approach, well, that would have localized effects. Things like a temporary headache or some discomfort right on the scalp. The difference is huge, and it really highlights why we need a more precise way to treat this.
So, this brings us to the alternative, literally hacking the brain with magnets. I know it sounds super futuristic, but it's a very real, very established technology called transcranial magnetic stimulation, or TMS for short. And it's a completely different way of thinking about treating depression. So what in the world is TMS? Well, to put it simply, it's a non-invasive way to use these powerful, really focused magnetic fields to reach right through the scalp and skull and directly activate the nerve cells, the neurons, in a very specific part of the brain. There's no surgery, no anesthesia, just the fundamental laws of physics doing their thing. So how does a magnet do that? Well, a coil is placed over the head, and it generates a rapidly changing magnetic field. Now, if you remember anything from high school physics, you'll know that a changing magnetic field creates an electrical current in any conductor that's nearby. And in this case, guess what the conductor is? It's your brain tissue. It's this incredibly clever way of using magnetism to create a tiny, precise electrical pulse exactly where you need it. And here's what it actually looks like when it's happening. The patient just sits comfortably in a chair, and this positioning frame holds the magnetic coil in the exact right spot. The machine sends out these little magnetic pulses, and that field it creates stimulates a specific region of the brain, causing the neurons in that area to fire up and get active. It's a really calm, controlled, and super targeted procedure. So where exactly are we aiming this thing? For depression, the main target is a specific finger-sized spot in the brain. It's got a mouthful of a name, the left dorsolateral prefrontal cortex, but you can just think of it as the brain's mood regulation hotspot. Neuroscientists have figured out that in people with depression, this exact area is often underactive. So the goal of TMS is, pretty literally, to wake it back up. Okay, so a targeted magnetic pulse is one thing, but the big question is, does it actually work? Let's take a look at the evidence for how TMS can effectively rewire the brain's mood circuits. These brain scans show you the goal perfectly. On the left, you're seeing the brain of someone with depression. See all those cool blue and green colors? That means low levels of activity. Now look at the right, that's a non-depressed brain, full of warm reds and yellows, showing tons of activity. The whole purpose of TMS is to turn the brain on the left into the brain on the right, to just boost that activity and get things back to normal.
The whole thing is this really fascinating chain reaction. It all starts with electrical energy in the machine, which creates a magnetic pulse. That magnetic field then causes an electrical current inside the brain tissue. This current activates the neurons, making them fire. And finally, this change in brain activity, when it's repeated over many sessions, leads to a real, tangible change in behavior. The depression starts to lift.
And just so we're clear, this isn't some brand new experimental idea. TMS has actually been approved by the FDA for treatment-resistant major depression all the way back since 2008. That means it has a long track record as a safe, well-established, and totally legitimate medical procedure. So just how well does it work? Well, the numbers are pretty impressive.
Studies show that about 1 in every 2 patients who go through TMS therapy has a significant response. And that just means their symptoms are substantially reduced. That's a 50-50 shot at feeling much, much better. And for a lot of people, the results are even better than that. About 1 in 3 patients who finish a full course of TMS achieve full remission. Remission. That means their symptoms are basically gone. They're effectively free from depression. Now, for someone who has tried multiple medications and nothing has worked, that statistic is absolutely life-changing.
But the story doesn't even end with depression. This technology is opening up entirely new frontiers in treating a whole range of other neurological and psychiatric conditions. It's really exciting stuff.
Yeah, the list of applications is just getting longer. The FDA has also given the green light for TMS to treat obsessive-compulsive disorder, to help people quit smoking, and even for migraines. And beyond that, researchers are looking into its potential for things like PTSD and chronic nerve pain. It's turning out to be an incredibly versatile tool.
Now, TMS isn't the only player in this game. There's also its cousin, TDCS, which stands for transcranial direct current stimulation. Both are non-invasive, which is great, but they work pretty differently. While TMS uses a magnetic pulse to hit a very specific focal area, TDCS uses a direct electrical current to influence a much broader region of the brain.
Actually, there's a great way to think about the difference. TMS is kind of like jump-starting a car. It delivers this powerful pulse to force neurons to fire. It literally jump-starts the circuit. But TDCS, that's more like turning a volume knob. It applies a weak, steady current that doesn't force neurons to fire, but it makes them a little more or a little less likely to fire on their own. It just turns the volume of their activity up or down.
All of this leads to a pretty fascinating final question. Instead of writing a prescription for a chemical pill, are we heading toward a future where doctors write prescriptions for a specific frequency, duration, and location of electrical or magnetic stimulation? It really seems like we are at the dawn of a new era, one where we can finally speak to the brain in its own native language, electricity.